Welcome back. I'm Dr. Lance Davis. This is going to be Dive Medicine Module 1. And in Module 1 we're going to be talking about dive-related problems, recognition, and initial management that are going to be indications for treatment in the hyperbaric chamber. Again, there are many things that can happen underwater to a diver. There are injuries or illness. Some of them would be indications for hyperbaric oxygen chamber treatment, and others would be for other forms of medical or surgical care. So this is going to focus on 3 diagnoses that potentially a diver might have to deal with. And what we're going to talk about is arterial gas embolism or air gas embolism, specifically the cerebral gas embolism, where a bubble gets to the brain and causes a stroke-like phenomenon. We're going to talk about decompression illness, type 1 and type 2, and we're going to mention carbon monoxide poisoning, which some divers potentially could get. Let's start with carbon monoxide poisoning and just get that out of the way. It's pretty rare that this would happen. Now, if you're part of an organization with strict safety standards about how your tanks are charged, or you're diving through a reputable dive shop where they've got relatively fixed equipment, the odds of you ever getting contaminated air, contaminated with carbon monoxide in your dive tanks is pretty low. It's possible, but very unlikely. If you're diving somewhere else, maybe someplace more remote, more primitive, more on the go, where they're using a portable air compressor, it's possible that the outflow, which is got contamination with carbon monoxide from the motor that's doing the compression, might be a little too close or upwind to the intake, and so they could be charging tanks with compressed air, compressed with a portion of carbon monoxide, and then you're getting compressed carbon monoxide and getting intoxication that way. Carbon monoxide is odorless, colorless, tasteless, and non-irritating, so you don't know you're breathing it, and the symptoms are lightheaded, dizziness, confusion, maybe some nausea and vomiting, some headache. Sometimes you get cherry red lips or bright red skin coloration, but that's not always. You might get ringing in the ears, unconsciousness, and death. Fortunately, even if you just get put into a hyperbaric oxygen chamber after diving, if they don't know what's wrong, the treatment for carbon monoxide poisoning and for the bubble problems, decompression illness and arterial gas embolism, is really about the same, so you'd be getting treated either way. But if you show up at an emergency department with alteration of consciousness or some other problem, probably you'll be actually diagnosed because they'll do an arterial blood gas before treating you. So that's carbon monoxide poisoning. Again, probably not going to happen, but just a little culprit to be aware of, especially if you're diving someplace and maybe the setup is a little shady.